Joe Burrow of the Cincinnati Bengals left today's matchup against the Jacksonville Jaguars, and there was a lot of speculation initially as to what exactly was going on with his injury. Not too long after that, he was officially ruled out with a toe injury, and we were awaiting the severity on that. As soon as Burrow was ruled out with a toe injury, the general consensus was that he was dealing with some form of turf toe. And there is a grading system for these turf toe injuries. The grades are 1, 2, and 3, with obviously a grade 1 being the best case scenario and a grade 3 being the worst case scenario. As of right now, current speculation is that Burrow would miss at least 3 months with this type of surgery, but he is currently evaluating his options. So with today's video, I want to go over the specific anatomy of turf toe as well as the specific structures that are located in that toe area. Then we'll go into more detail on that grading system and finally talk about the recovery process. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I try to explain them so that they are a little bit easier to understand. I'll also talk about the relevant anatomy for that particular injury as well as the physical therapy process. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered turf toe, go ahead and comment on your experience in the comment section below. Now we see here on the injury replay that as Burrow is scrambling, he is going to plant with that left foot while he's being brought into the ground. And as this is happening, we see that foot and toe area go into a lot of hyperextension and the foot is going into a position known as dorsiflexion. Here's another close-up view right here. Once again, as he's being brought down to the turf, you can see that as the cleat gets caught into the turf there, a lot of hyperextension is going through the toe as well as dorsiflexion through the ankle. This is important to know because this is a major mechanism of injury for these turf toe injuries. Here I have a model of the foot and ankle, and so since we're talking about a turf toe injury, I'm going to go ahead and flip the model like this. Turf toe is a sprain of one or multiple ligaments that are located at the big toe joint right here, known as the metatarsophalangeal joint. Now there are a lot of soft tissue structures that are located at that first MTP joint. The first one and most common one that's injured when we're talking about turf toe is known as the plantar plate, which is located right in through here. There are also two collateral ligaments that are located at that first MTP joint. We have the first one being the medial collateral ligament located right in through here on the inside, and the lateral collateral ligament, which is also located here on the outside. The plantar plate is going to prevent any sort of hyperextension going through that first MTP joint, which is basically what we see in this video. We see that as he's being brought down into the ground, he's getting a lot of excessive hyperextension going through that first MTP joint, which in turn is going to stress that plantar plate. Also, if he is getting any sort of force that is going to stress the medial collateral ligament or the lateral collateral ligament, the toe is going to need to bend either one way or another. Kind of difficult to see on the video as to whether or not the toe is being bent in more of a diagonal motion there, but it's important to know that multiple ligaments can be injured when we are describing turf toe. I touched briefly earlier on the grading system of turf toe injuries, so I want to go ahead and elaborate on that a little bit. When we're talking about a grade 1, this is where we are basically getting stretching of the affected ligament. In a grade 2, this is going to be considered a partial tear. And finally, in a grade 3, this is where we are getting a full rupture of the affected ligament. When we're talking about a grade 1, this can heal anywhere from about 1 to 2 weeks because we're just getting stretching of the affected ligament. In a grade 2, this can take anywhere from about 3 to 6 weeks. And finally, in a grade 3, because this is going to require surgery, this will at least take 3 months at a minimum, sometimes upward of about 6 months. So the fact that as of right now, sources are reporting that he has suffered a grade 3, once again, unfortunately, this is the absolute worst case scenario, and this is usually going to require surgery. Anytime we get somebody in the clinic for a surgery that is for turf toe, usually it's going to be a repair of that plantar plate ligament, and it may be one or both of those collateral ligaments, depending on the severity of the injury. But for a period of at least 4 weeks, usually the person is non-weight bearing and immobilized. They're doing this for a number of reasons. First of all, because the structure that has been injured here is injured when that toe goes into hyperextension. You want to prevent any sort of stretching going through that big toe. So they are usually in some sort of splint or some sort of boot where that foot is not allowed to go through any sort of dorsiflexion and that toe is just not allowed to go through any sort of extension. Then at about the 4 to 6 week mark, we can start to work in very gentle range of motion to the big toe, but a lot of times there are precautions for this to not push it too far because once again, you don't want to overstretch the surgically repaired tissue. After this, then we can start to work in gentle strengthening and slowly progress the person to normal weight bearing again. The typical time frame for a person to return to modified or non-contact sports is going to be about the 3-month mark. And for full contact sports, usually it's anywhere from about 3 to 6 months. So as of right now, the fact that they're saying at least 3 months, it seems to be very accurate, but it would be very surprising for him to return to full contact sport at about that 3-month mark because it usually will require longer than that. If I happen to hear any updates regarding Joe Burrow's case, I'll be sure to update everybody in the comment section. I'm sure we'll get some more details in the coming weeks as he is going to consult with other physicians and hopefully we'll get some more advanced imaging results. So we wish Joe Burrow the best of luck moving forward with this turf toe injury. Once again, unfortunately, it is the worst case scenario, so he does have a long road ahead of him when it comes to the recovery process, but we wish him all the best. Thank you so much again for tuning into my video today. If you enjoyed this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.